Hello, Dr. Stephen Muholland, plastic surgeon coming at you from Seattle, Washington. We've been at an InMode advanced training workshop where we're going over the latest high-tech ways to have people look great. InMode technology, the Optimus, the Morpheus, dialase, photo rejuvenation, injectable toxin, injectable filler. This young man is a provider who delivers excellent integrated quality care, injectable skin care, energy-based devices. Stefan Torrès at Torres Aesthetics. Whereabouts are you located? How can they find you?
So I'm in Edmonds, Washington. I'm right by the ferry that goes over to Kingston. Anyone familiar with the area would know where it's at. To find me, it's as far as social media, internet goes, TorresAesthetics.com.
You're in the space, you're enthusiastic. I've had a chance to talk to this young man. He's very enthusiastic, cosmetic certified provider. And what does your vision of patient care look like? What can they expect at your facility?
Yeah, well, it's very different than a lot of the other ones, particularly in the area. Got large staffs. The way I work is fairly independently, kind of a one-on-one, more of an intimate, personal type of relationship and rapport that I build with patients. And it's a lot different than going into a place and talking to 4 or 5 different people before you get a chance to be injected, or having 4 or 5 pokes and then you're out the door. I always do follow-ups. I always do my complimentary consultations, and I just make sure that I have a good photographic and also documented kind of progression of treatment.
So what I'm hearing is very much a concierge care where they get a lot of time with you.
Exactly, yes.
And you're a seasoned injector of Botox and filler. Mm-hmm. And what other integrated energy-based systems do you bring then to their face or their body treatments?
So injectable-wise, I also do Kybella, but when it comes to the energy-based, the Optimus, laser hair removal, the Morpheus, as well as the dialase.
And the photofacial, the Mecca photofacial for rejuvenation.
Yes.
So you're going to be able to treat brown spots, rosacea, clarity, luminescent skin, the Botox and the filler, of course, and then the Morpheus. Tell us what excites you most about treating patients, and what are some of your passions in treating patients?
It's coming from my background in the hospital, that's why I got into healthcare, that's my drive in life. Whatever's propelling me forward is, I don't know. I've realized that I could do that in the aesthetics realm. The demographic in my area is kind of an older population, and there's a lot of skincare needs. Right. And that's what I see that a lot of the Optimus focuses on. And that's exactly what I want, is to be able to help with a lot of the things that I see that, okay, I can do a lot with Botox, I can do a lot with filler, but there's certain things I just can't tackle yet. Being able to do that with the Optimus was something that, being able to implement that is just perfect.
So delivering integrated, beautiful skin.
Exactly.
Looking natural, not done.
Exactly. One of the biggest things I hear I'm sure a lot of people hear this when they come in. My particular demographic is always I really want to age gracefully. I want it to be subtle, but I don't really like this particular spot, or I don't really like how my jowls are sagging and whatnot. And so it's just the perfect device to be able to do that.
So integrated personal concierge care, injectables, Botox, filler, Optimus energy-based device, color correction, tightening, the Morpheus, of course. The Morpheus is really quite a phenomenon now internationally. Well, what appealed to you about the Morpheus and what it can do for your clients' complexion, face, and texture?
Oh, everything. It's just it's the tightening aspect of it. Like I said, what really has got me kind of sold on is being able to do the jowl area. Right. I treat right now as far as using the foundation of fillers with the cheeks and the chin and the jawline, being able to kind of emulate that. But that doesn't really do anything for the actual underlying area. And so,
especially as you say, your demographic may be a little older, and tightening may be what they need.
Absolutely.
In addition to judicious volume and Botox.
Yeah.
Excellent. Well, this is a kind of advanced aesthetic and really craniofacial structural analysis that most clinics don't give, and most clinics don't have that same kind of concierge experience. So this young man is looking to see you soon. Again, remind them how they can find you.
Absolutely. Yeah, so right now, TorresAesthetics.com, or on Instagram. Find me on there. Just look up Torres Health or Torres Aesthetics. You'll find me.
So Torres Aesthetics coming to you. Looking forward to turning back the clock on your complexion and your appearance.
Yes.
Thank you.
Thank you so much.